Welcome back. Sandra Bavacqua is a PhD in molecular and cellular biology and an international women's health specialist.
She educates women and their healthcare providers in understanding the complexities of women's healthcare needs. She works from her office, World Integrated Systems and Health, and she joins us now. Welcome, Dr. Sandy. How are you today?
Good, very, very good.
Now, last time you were on, you introduced us to the high prevalence of urinary incontinence and urinary frequency and urgency. Today, you promised that you were going to talk about pelvic organ prolapse. What can you tell us?
Well, first, I'd like to start by reminding everyone that pelvic health concerns involve more than just the urinary incontinence and urinary urgency. The pelvic organ prolapse we'll talk about today, that was when an organ falls down in the pelvis. It can come into or through the vaginal space. And also it involves pelvic pain issues and sexual dysfunction. And we can talk about that in our next segment on the 16th. But pelvic, what we want to discuss today is that there's many people that are dealing with pelvic floor failure and pelvic organ prolapse. 50% of all women who have had a single birth, a vaginal birth or more, have some organ that will fall sometime in their lives. So that's really a lot of women, you can imagine. And at least more than 10% of women will search out surgery, but it turns out that a lot of those surgeries fail. Somewhere between 10 and 54% of those surgeries will fail, and it's unfortunate. So women go back 2, 3, 4 times, sometimes even more. And the truth is that, as we know, there's a lot of urinary incontinence, and that the urgency and incontinence can be due to a hidden bladder prolapse, a bladder that's been falling down. And we know that a lot of these cases, at least the majority, 90% or more now, we know can be cured or completely addressed with other solutions other than surgery. And if we look at the causes and symptoms of pelvic organ prolapse, we'll see that there's childbirth, we've already discussed, but any woman that's carrying a lot of weight, either her own body, obesity, or carrying weight, maybe she's a construction worker, there can be chronic constipation, chronic coughs, anything that's creating pressure in the abdomen, and also the surgical removal of her uterus can leave a gap and organs can fall into that space. So that's a real big problem. And the symptoms she can have, the most common symptoms are like pressure in the abdomen and perhaps low backache, a painful intercourse, and she can also feel that something is coming into the vaginal space, and of course if it falls out, that's pretty obvious. And we have a number of different conditions that can occur, and we can see here that there's the normal position of our organs are the bladder, the uterus, and the rectum, and they should line up with each other and be in a correct alignment in order to stay in position. But if one is removed, or there's other issues can happen that can allow for an organ to fall into that vaginal space. And the most common was the second image there, which was the bladder falling in. We call that a cystocele. And then the rectum can fall into that space. It's called a rectocele. And there can also be a uterus falling into that space. And that's that last image where the uterus is falling straight down. It's very common with repeated childbirth. So we know that there's a lot of more natural ways of taking care of that. In fact, my team has and I have developed a program called the Pelvic Health Transformation Program. And this is a educational program that happens in the comfort of one's own home. So it can be very private for the woman. It's an interactive education program, and we have over 20 practitioners as a part of that program that help to individualize the training that each woman gets. And it may not be that this program will fit everyone's needs, but we can determine whether a woman would be right for the program or not.
And what kind of results are the women having that are going through this program?
Well, excellent results. I can tell you that we're getting about 96 to 98% recovery, and we have one lady actually had 6 surgeries in 3 years. And she started with a very small prolapse, and she ended up with having complete the prolapse of the bladder, the rectum, and both kinds of incontinence, and she's better now. So we have really great results. I'm very excited about that. And so.
And you have something for our viewers actually today as well, correct?
Yes, I do. If a woman is not sure, if she has an issue and she's not sure what to do, she can call the office at 743-0575, and she can receive a free 10 to 15-minute consult. I'll help each woman find out what's right for them, give them some suggestions, get them started. And they can also register for a free ebook that I have listed here, 20 Early Warning Signs. Please, ladies, get that into the hands of the young women so they don't have to suffer anymore.
Well, thank you, Sandy. I'm going to re-go over that information one more time. You can receive a free gift, the 20 Early Warning Signs of Pelvic Floor Disorders, by registering online at pelvicbowlofsteel.com or call 743-0575 for a free 10-minute appointment to discuss your concerns. Again, that phone number was 743-0575.